morning, we have with us Owen Brooks, who's recently retired as the Director of Global Procurement Capital, MRO, and Assets. And he is joined by one Luke Kimmel, who's the Managing Engineer, Global Process and Equipment. And their presentation has a very intriguing title. If you've looked at your agenda, it's Buy to 3 bids and a buy. One of the things you've heard is the afternoon has progressed, or perhaps it's morning or even early in the wee hours from some of those who are listening from afar. One of the things you've heard is the importance of a tsunami of technological improvement on the way that we make decisions and the way that we manage our projects and the way that this technology revolution will impact our business. And we're very honored today to have our Pfizer representatives, Owen Brooks again, and Luke Kimmel. Buy, 3 bids and a buy. Share with us, if you would, please, what you're talking about.
Owen Brooks, and as I was introduced, I'm the recently retired Director of Global Procurement based out of New York, and had the responsibility over the last year I was there to somehow pull a rabbit out of the hat and help supply the equipment and some facilities work that was required to deliver on the COVID vaccine. It was by far the most challenging set of circumstances you could find yourself in. You know, most people, as they're planning towards a known retirement date, to have something like this happen was staggering, and the amount of collaboration and work within Pfizer and with our supplier community had to basically be perfect in all aspects in order to make this work. So I'm going to just talk through a couple of reminders on dates. Okay, you know, we're into February of 2021. In February of 2020, the U.S. had its first death that was related to the COVID virus. That number quickly went up into the tens of thousands, and now it's in the hundreds of thousands. And it's a serious, in some ways depressing scenario for the world to experience. Of course, the numbers globally are much, much greater. So the year has been a blur, right? For us outside of this effort, having to quarantine, having to kill all travel, having to eliminate get-togethers with our families and friends. It's had a profound effect on everything we do. And I guess one thing I would consider for myself is that I'm blessed to have been able to have been a part of a solution, and working closely with Luke and others within Pfizer to help make this happen. So, you know, from the time this was announced within Pfizer that there was a possible solution, that was in April of 2020, and a commitment was made by Pfizer that we would have vaccine available for consumption by the end of the year, and that truly is an unheard of timeline in our business. It usually takes years to not only develop a new product, but to test it, approve it, and get it into distribution. It's usually a multi-year process. So again, this effort really called on perfection in all aspects. And I'll focus a bit on the procurement steps that had to change overnight within Pfizer. Luke will get into some of the other perspectives of this, and again, how we had to work very, very closely together to make this happen. Luke?
Sure, thanks, Owen, and thank you guys for allowing me to share with you a little bit today. One of the key things that I want to highlight here is that even though COVID is at the forefront of all of our minds. And I think if you go back to Kurt's presentation about, if you type Pfizer into that Google search bar, probably the first 50 pages will come up is everything related to Pfizer COVID vaccine, Pfizer clinical trial, all that kind of stuff. You probably have to go into page 52 or 53 before you get to the financial statements of Pfizer. However, if you go and look at those financial statements, if you look at the releases that we've had, you'll notice that Pfizer is a lot more than just COVID. And this is just a summary of our last earnings announcement for a number of our other products that we have within Pfizer. And so even though the world and everything is focused on COVID, Pfizer has a whole business to run, right? And if you think about all these different products, the millions of patients that are in high need of these products, COVID's important, but we also supply so many medically necessary, patient-critical medicines and treatments that Pfizer couldn't forget everything else. Pfizer couldn't throw all of its resources into COVID. It had to continue to manufacture, had to manufacture safely, had to manufacture on time, had to manufacture the products and the treatments necessary for all of our patients. So again, I want to frame the reference of where Owen is going of COVID and the requirements of what COVID drove. It was all on top of what was already happening. And if you notice, it just highlight on the slide, it's a slide of pride for Pfizer, right? Is you notice a whole lot of pluses and not a whole lot of negatives on the slide. So even in the midst of a global crisis, healthcare, and the pandemic, Pfizer is not only able to deliver COVID vaccine, but is also able to deliver all of these other medically necessary treatments and therapies for our patients. So if you go to the next slide, Owen, the other thing about Pfizer, again, if you go to our webpage or if you actually go to Pfizer.com, you'll notice that the Pfizer purpose is breakthroughs that change patients' lives, right? Again, COVID vaccine, very important, but in the midst of that, we have to maintain what is Pfizer about. Pfizer is bringing new therapies, new treatments, new breakthroughs that are going to make a difference in people's lives. And so we have a very robust pipeline of activity outside the COVID vaccine in multiple different segments, oncology, internal medicine, they're on the screen here. We had to maintain our pipeline as well. So we have this massive challenge of COVID hitting us. We have a robust portfolio of products that our patients need, and we have a very full pipeline of products that our patients are waiting for. So balancing all of those imperatives, all of those initiatives is incredibly challenging, and they all require resources, they all require effort, they all require investment. And what Owen's going to talk here about is how do we balance all of that, but yet achieve something that's never been achieved before from a bringing a product to market standpoint. How do we achieve the ability to get our manufacturing facilities ready and tuned up and capacity enabled to supply vaccine that we're supplying right now? So I'll turn it back to Owen. I just wanted to give the context of what this is in Pfizer network right now.
Thank you, Luke. I'm going to start by saying this. You're all in, for the most part, in the construction business. And I'm sure you've all at different times come up against your procurement teams who like to reset the rules for you and like to remind you that, well, we can't do things quite that way. And these are usually very well-intentioned comments, and procurement folks are trained to look out for the best interests of the company, and their methods usually fall back on some tried and true principles, such as, well, we have to bid this work because of the size, because of the magnitude of what we're talking about. We need to be sure we're getting the best deal and are saving money for the company. I'm guilty of that. I've done it many, many times. Some of the challenges we had within Pfizer is that our procedures are very, very clear that once we get to certain thresholds of spend, we must bid that work. We must make sure we have strong negotiation strategies with our suppliers. And some of these, unfortunately, differ from site to site, from region to region. And then to complicate it a little bit further, we have preferred agreements with our key suppliers, which do in some ways lock us into certain types of deals and certain ways of doing businesses on a global basis. Well, along comes COVID and a commitment to the world that we're going to deliver a vaccine, not just deliver it, but deliver it in 8 months. Meanwhile, we're faced with lead times that are in some cases well out into a year and a half plus. So the need was immediate to us that we needed to create a number of exceptions to our traditional principles in order to achieve the objectives that Luke made very, very clear to us back in the early part of last year, that we have no choice. We must do things differently. We must innovate. We must create better ways of doing business. So we went fast track in all aspects, right? So we needed to be really very, very respectful to the needs of our customers, our internal customers. It was the only way we were going to satisfy those needs on timing was to really buy into the needs, become part of those teams. We certainly had the support of our top leadership, who were very encouraging and encouraging us to work differently, to work faster, to work better. Cross-functional teams were a major part of this. We had to really bring in all aspects of our business. All of our procurement teams, our engineering teams, our technical and manufacturing teams all had to come together in this effort to identify the objectives, agree to what needed to be done, and then make it happen. What was really different here is that the team, and a lot of it was led by Luke here, was the team was empowered to make the key decisions to move this forward. So we didn't have to work through a lot of red tape internally at Pfizer. The team was empowered, the team moved fast, and the results were excellent. Anything to add there, Luke?
No, I think that's a key point in your summary. The alignment from senior levels all the way down through the engineer designing and speccing out a specific pressure element, for example. Everybody had the same alignment and the same goal, and it was that all the way top to bottom, the decisions were made. There was no conflicting decision because there was one guiding principle, and that was incredibly empowering because there was no second guessing. It was move forward, move forward, move forward.
Exactly. Now, what I'll add here is that the some of the challenges we had with our key equipment suppliers, we got many reasons why things couldn't be done. Traditionally we would go out and we would look to really look at capabilities and pricing across many suppliers to establish new manufacturing lines. We didn't have the luxury of time in this case, and we really had to identify suppliers that not only understood what the challenge was, but truly embraced the program. Everybody was feeling the pinch and the pain of COVID. So it made the sell relatively easy. And it encouraged the suppliers to really commit to solutions which were almost unbelievable. We had to also, in this, had to find suppliers who were really willing to allow Pfizer to work within their supply chains. And I'd say for the procurement aspects of this, that was probably the most significant piece that gave us the best results. Many manufacturing suppliers always get hung up in something in their supply chain, and it doesn't show in the schedules they provide back to us, okay? Once we started prying those layers apart and interjecting ourselves with the supplier support into their supply chains, sometimes 3 layers down, the results really started to turn around. Simple hardware suppliers, for example, once they realized they were part of the solution to COVID, they jumped. They went 24/7. They bumped our work up in priority. we were so grateful that those types of responses, not just once, but they repeated time and time again, and allowed us to really pull off some miracles on timing.
I think I would add to that, Owen, the concept there of ensuring that your suppliers and their sub-suppliers understand the purpose, right? And whether it's a COVID vaccine or whether it's another program, right? In the farm industry, right, a lot of our products are medically necessary or they're life-saving medicines. And what we find is that the further away you get from us, right, the further down that supply chain levels, like Owen was describing, 2, 3, 4 levels down, people don't know what they're manufacturing for. They don't know what this is component for. And when you open up and help them understand that it is for a COVID program, it's for a critical vaccine, it's for a key cancer therapy, it's for once that awareness comes, the perspective and the stance of the suppliers change really quickly, because everybody wants to be part of that, right? It's doing good for humankind, and pulling them into the story, pulling them into the ownership of being able to deliver that. Like Owen said, the results were unbelievable, absolutely amazing, and things that you would say are not possible, people do, right? People are amazing at what they can do when they have the right motivation and the right focus. And so, yeah, I would just encourage that lesson of helping people understand why they're doing what they're doing, even at the very low subcomponent level.
Right. Part of our analysis of this, going back when the program really started to come together for COVID, there were a number of questions raised. Gee, have we ever done this before? And certainly in recent history, I'd say no. There were projects that were certainly high priority and demanded certain attention, but prior speaker talked about history. So here's a quick history lesson. Within Pfizer, back in the 1940s, the great miracle drug developed in the UK was penicillin. And unfortunately, the UK was in no position to mass produce penicillin during World War II, and that responsibility came over to the US. Pfizer was one of the companies selected based on their technical expertise to hopefully take a crack at mass producing penicillin. And it was a huge success for Pfizer, to the point where every medic that went ashore on D-Day carried Pfizer penicillin in their pack, ready for use, ready to use in case of injury. And it really ended up becoming a great strategic advantage for the Allied forces in World War II. That happened through real grit and guts within Pfizer. They dropped all concern on schedule. It was complete focus, and it was a great example of how things can be done in a military type environment. This is very similar. This was run within Pfizer almost as a military priority project, if you will, where all efforts were top tier, and all roadblocks, any walls hit, were to be immediately escalated and run up through leadership where necessary. And what that brought about was a stronger SRM, supplier relationship management program, with our key suppliers, where in some cases our top leadership was getting involved directly with the top leadership of our key suppliers. And the results are going to be long lasting. I'm excited about that, that those relationships are going to bear fruit for those suppliers and for Pfizer for years to come, because of the trust and the development that's taken place because of this. So yeah, difficult times can really bring about positives like that if they're allowed to develop. And it's really, really been tremendous for not only Pfizer, but for our suppliers to have that type of visibility and trust and involvement in a major program like this. Again, I discussed earlier that we did work down many layers in supply chains. That was a task that our procurement teams were not really accustomed to, but we're very excited to get in there, and the suppliers certainly benefited from that additional clout and help. It validated all the demands they were placing on their suppliers. When they heard Pfizer directly involved, they then understood that, yep, this is a real issue. I'd say one of the more interesting outcomes of all this, and there was a lot of concern that, gee, if we're racing past bidding, if we're just getting proposals and negotiating those proposals almost as a single source type requirement, what's that going to do to our pricing? Well, lo and behold, the pricing has been fairly consistent. With a couple of checks back historically, these suppliers were giving us good pricing. We didn't see any scalping or really inflated costs because of the demands on time, and we were very pleased about that. We have seen market fluctuations in the supply of PPE and things like that, as I'm sure you all have as well. But in the capital end, not too much. And I think it really had a lot to do with bringing in those suppliers at the right time, in the right way, focused on a very aggressive outcome, and it's worked out well. So the relationships we've struck with the suppliers, I can't say enough about that. We owe thanks to so many suppliers out there, not only in the capital area, but in the construction teams that work within our facilities to get teed up for the new lines, for the manufacturing suites for COVID. Our original orders are leading to new orders where we're looking to expand capacity and be able to deliver on even more volume for the COVID vaccine. The need is clear. It's kind of depressing that a year ago we saw the first COVID death, as I said earlier. We're now up to a number that's approaching 500,000 U.S. alone. And if you look at that across the globe, 2.25 million deaths related to COVID. It's heartbreaking. And so the need for us to deliver more and more is obvious. It's a strain. It's tough on our colleagues, but is absolutely necessary. And we also welcome the efforts of our competitors to be doing the same thing. You've heard about that on the news. There's other companies that are coming online in the very near future. So the work is so important, and we are excited to keep it going. Luke, do you want to talk about some of the challenges you're seeing now on volume?
Yeah, so I think one of the things that becomes really, really clear is that as we've come and have shown we have a safe and effective vaccine, it becomes a moral obligation to be able to supply as much of that as possible, right? It's not about plans or targets or goals. It really is, we have something that will save lives, and we can't supply enough of it, right? We and our partner companies, right? And I know Owen used the word competitors there, but the way we look at it is we're partners, right? Everybody's trying to solve this scourge that's hitting our globe. So one of the challenges that we've incurred as we've gotten past the safe and effective vaccine is, how do you make more? How do you supply more? How do you get it to patients faster? And so we continue to work with our suppliers. How can we ramp up production? How can we increase the output? Can we increase our capacity? And so Pfizer every day is looking and partnering and having conversations to increase that. And you notice, and some of the communications, right, from our senior leaderships publicly of how we've been able to successfully do that over the past few weeks here. And we'll continue. It's our charter, it's our mandate, it's our obligation to look at how we can continue to increase our supply, increase that vaccine for folks that need it. So that's been the biggest challenge. There has been no letting off the gas. There has been no step back to sit on the success of a product developed in less than a year, which is record time. Facilities that were made ready in a number of months, which is record time. Vaccine that's manufactured safe and effective and is being distributed to patients in record time. All of those things are great. All of those things you could, sit down, hang your hat on the hook and put your feet on the desk. But there's nobody within Pfizer that's doing that. There's nobody that says what we've accomplished is enough. Everything is about what more can we do. And the challenge is not to stop, not to rest, And, you have my word, you have my promise that that's exactly what Pfizer's doing. We're continuing to push to expand supply where we can. We're continuing to push our suppliers. They're continuing to respond. They're digging into their sub-suppliers, and we're asking things of suppliers. We're asking things that we've never asked before. We've asked for partnerships and transparency at levels that would not have been asked previously. And everybody's banding together to be able to try to address this. So I think, Owen, to the point of where we're at now, it's to continue excellence in manufacturing that we're doing, to continue to look to expand our manufacturing and be able to supply more of these vaccines as quickly as possible.
Right. In spite of what you hear in the news, we're a long way from getting to where we need to be globally on COVID. So the last check in the U.S. is that approximately 10% of our population has been receiving their vaccine, which is great. But that number has to get up to around 70% to get to what they refer to as the herd protection against a virus like COVID. So we still have a long way to go. And Pfizer's committed to doing it. And it's been an incredible year. And really, I've been thrilled to be a part of it. So thank you. And we welcome any questions you may have.
Well, first of all, Luke and Owen, I feel like I need to say thank you for your service, because what you're doing is you're on the front lines of this battle. And it's not a battle, it's a war. And it's a war which must be won. And it's a war with casualties. It's a war with procurement challenges, as you've said. And so it very much, we need to thank you for your service in making this happen, first of all. Second, you mentioned the team was empowered by the highest management level to do its job and to get to get this thing out the door as fast as possible. Can you talk to us just for a moment or two about what team empowerment means, what it looked like, and how it differed from your ordinary course of business a couple of years ago?
Yeah, Luke, jump in on this as well. I think you've been even closer to some of this, but from my perspective is that the traditional silos you see at Pfizer and really any company, department type silos disappeared in a flash, and the team became the COVID team. So regardless of whether you were part of our research or manufacturing or engineering or procurement, it didn't matter. It didn't matter. Everyone was instantly brought together and made a part of this, call it a TAC team, an action team to make this happen.
So how did you improve the communication that was obviously required for a fast track project? What did you do different that perhaps the team wasn't used to having done in years past?
So Luke, from my point of view on the procurement side now, right? We had appointed positions on the COVID team. Those people were responsible for linking all the pieces together and driving communication. So it was created outside of our normal methods of communication, if you will. Mm-hmm. Certainly all the tools were there, they were existing, but the communications themselves became team specific to drive the results and report up to leadership where necessary, or identify problems and drive corrective actions.
Yeah, and I'll add to that, Owen, on the manufacturing side of things, we organized based on activity. And so, as Owen said, there was no research, there was no procurement, there was no it was an activity-based team. And the empowerment came that team had one goal: bring the activity to a GMP compliant state so you can manufacture as quickly as possible. And so whether it was a specific piece of equipment that was needed to be procured, whether it was a specific type of experiment that needed to be run, whether it was a specific commercial strategy that needed to be employed, that team, based on the activity, had the empowerment to make all the decisions that was required to bring that activity forward as fast as possible. Those multiple activities then came together, those sub teams came together and funneled up into an overall governance where you were, at the governance level, you were making sure that each of those activity streams were progressing to the goals and the timelines, and then where needed, surgical intervention to support a roadblock or a wall or something of that nature, where senior management could support each of those activity streams in delivering the output on the timeline committed to.
So do you think some of those changes that empowered this team to do so well how will that change your program moving post-COVID? Are there some attributes of that you've learned that'll stick even post-COVID? Thoughts?
Yeah, look, I believe so. Certainly the discipline and structure of a team like the COVID team within Pfizer showed everybody that the impossible is possible. Yeah, I think that's going to certainly trickle out into our other projects and manufacturing teams fairly quickly, really because of the excellent results. It provides more of an appreciation on the value of the product than the, call it, cost savings. Some of my procurement friends would be cringing right now, but it's really a focus on the outcome as opposed to the individual steps of the program, right? And I think, yeah, I think that's going to be a factor going forward.
Outstanding. And perhaps in one of our fall meetings or autumn meetings, we'll have an update when you folks have had a chance to breathe and think about what you've just experienced. I'm sure this is a whirlwind and will continue to be for quite some time. I understand from our control center that we've got several questions. Greg, you care to lob one over to Luke and Owen?
Sure. What do you think were the critical steps and catalysts that were expedited in order to produce and provide the vaccine so quickly? And if it can be done once, can it be duplicated?
Luke, you want to take a shot?
He beat you to that, Luke. You should have spoken quicker, Owen, or I mean, Luke. Go ahead.
I think there's two key things. The first, and we've talked about it a bit, is the alignment around the goal or the outcome, and that empowerment. And that is something that can absolutely be replicated and should be replicated. I remember and I don't remember who it was, but a organizational speaker talking about, if you think of the workplace as a rowboat and you have 10 people in the rowboat, you have generally, on average, in our workplaces, 3 people rowing downstream. You have probably 6 or 7 people in the middle of the boat doing nothing, just sitting there. And you actually have somebody in the back of the boat trying to row upstream. And so trying to be effective in that kind of environment is tough.
Yeah.
One thing that we did with that alignment is you had everybody rowing in the same direction. So being able to do that is, in my opinion, one of the most important things to catalyze that speed. And that is definitely replicable. The second element that, in my opinion, allowed for the speed is, and this was a direct mandate from the CEO of our company, was do things in parallel, take risk that you wouldn't normally take. Again, if a company or an enterprise is willing to take those sort of risks of doing things in parallel, you could replicate that speed again. But in my opinion, that one's more situational of whether or not the situation is right to take the parallel risk. Alignment, absolutely, we should always be doing that. The parallel risk is a situational decision that leadership would take.
Have you also launched an organization or a group of people that actually captures what you're discovering to be best practices in this for use or future use? And if so, tell us a little bit about how you're measuring your success with these revolutionary changes to project management.
Yeah, so certainly on the procurement side, that is happening. As we speak, I know there are reorganizations taking place that I think are a reflection of what's happened here. And of course, the focus is on efficiency, keeping integrity alive, keeping compliance alive, but coming up with better ways to do things because of what we've been able to do.
Terrific. Greg, I understand there's several more questions that have come in. How about lobbing another one over to these fellows?
You mentioned improved supplier relationships at the highest levels. What other changes do you expect to be lasting?
Well, so yeah, certainly the relationships with our suppliers, it goes without saying that the fact that we were able to identify these suppliers early, get them to buy into the program, and really rely on their skills to help drive some of the results, that's going to be long lasting. That's easy to talk about. I think some of the things that are more difficult to talk about right now are all of the impacts that are taking place within Pfizer because of these successes. It's going to change how things are done in the future. There's going to be an expectation. I see this coming. There's going to be an expectation that if we did it once, we can do it again, and that's going to force a change to certain procedures, certain different ways of doing things, how we collaborate, how we communicate, how we work together. Those will be lasting changes that will likely come out of all this. I don't think at this point we've sat down to scratch out the details of how that's going to happen yet, because we're still very much in the midst of the battle, right? So, but that'll be an effort that'll be time well spent once we have a chance to.
Curiously, as an industry, are you benchmarking with the other vaccine providers, J&J and others that are Moderna? You hear these names have become common household names now, as is yours. Is there any industry benchmarking to identify best practices for more efficient, more productive procurement management, product management, project management?
Well, I'm not close enough to the science, if you will, on where there may be some shared information taking place between companies. I don't know, and I don't want to misspeak on this, but I'd say at this point, there hasn't been a huge amount of collaboration at the procurement level with the various companies, only because each of the companies are under the same stress and drive to get vaccine out on the street. I do suspect that'll come when it's appropriate to have those discussions, and I think all the companies could benefit from that.
And many of those organizations are part of the Construction Users Roundtable, as are you, and it might be an interesting project for our own procurement committee. Greg, I understand there's more in the queue. What's next?
Crisis is often an opportunity for innovation and success, but only if one is prepared. What about Pfizer's culture and processes helped prepare it for the enormous challenge of producing a COVID vaccine with the lightning speed this crisis demanded?
I'll take that one, Owen. So I think
you, Owen.
A really good
I had a good answer too.
observation.
Well, we'll get to you. Let's rewind and start with Luke so we can hear what he's saying. That was my fault. I'm sorry, Luke. Go right ahead.
No problem. So I think one of the things that you'll notice is that Pfizer recently had a rebrand of its forever icon, right? The little blue pill to a different icon. We've spun off a business unit, and we are solely focusing as an innovative company. And so that doesn't happen overnight. Obviously, there's a long-term planning effort, and there is internal workings to be able to start to shift the focus of the company that way. The COVID challenge landing right in the midst of this company retransformation into an innovative biopharma company, it was, you could almost say, serendipity, right? That was the focus of what Pfizer was doing when this challenge came. So Pfizer had its years on, if you want to say that, in the space of being ready for innovation, challenging innovation, and there is a strong culture of innovation within Pfizer, and really doing things as best as they can, and learning and growing, and not only within the pharma space, but also learning from other spaces as well. So it was a perfect time for the Pfizer kind of rebranding to be met with the challenges that come with a hyper-fast program.
Interesting. Owen, you had a comment.
One point. I'll just add one point.
Take your time.
Never through this entire effort did I ever hear anyone say no. It was not uttered one time. So I think that says a lot about the culture, right? once the challenge was put before us, it was like, how do we get there? What are we going to do? What do we need to do with our suppliers? What do we need to do internally? Let's make it happen. So it's that type of positive vibe that I think really helps to drive results like that.
Boy, you're so right there. Were there any unexpected setbacks or surprises that emerged as a result of this fast track deliverable?
Yeah, certainly every day. Every day presented a challenge.
Every hour.
Every hour. Yeah. This was not easy to pull off. Every supplier, speaking for procurement again, now every supplier had an issue somewhere, somehow, some way that had the potential of tripping up the entire schedule. The trick was to identify those, attack them. Every single time something was brought up, we attacked it. We agreed within the team that it's the best approach. We determined whether that supplier needed special assistance. And in cases where that was identified, we jumped right in and helped out the supplier. Supplier certainly appreciated that, and it allowed them to achieve their objectives back to us. So yeah, a lot of collaboration and patience and a willingness to not give up on any point.
Great. Luke, you care to weigh in on the answer as well?
Sure. Yeah. Anytime you do things in parallel, right? So the normal process is sequential in development of a vaccine, or the delivery of a facility, the delivery of manufacturing equipment. So when you take a sequential process and you put it into parallel steps, you are automatically taking risk in certain things because you're making decisions before you have data input to make the decision. And based on that, you have two paths. One is create contingency plans, which if you see some of the internal discussions, we have all the way down to plan D and plan E on certain topics because we just didn't know. And then there's all the contingencies that you can't plan for. Mm-hmm. And sometimes you make a wrong decision because you didn't have the right data. And the way that those setbacks were overcome is exactly what Owen said previously. The answer wasn't, oh, why did you do this? Oh, that was a bad decision. It was, this is where we're at. How do we get to the next step? So that very positive, you never look backwards, always looking forward. Even if it wasn't the perfect decision, we realized that you aren't always going to make the perfect decision. It's about making the next decision to keep the program moving forward at pace.
You know, that's reflects a little bit what Kirk Perry was telling us shortly ago, that, you know, they welcomed failure. And if you were with us yesterday, you heard Rich Bainey at Scripps Corporation say their biggest watch out was, have people failed enough to demonstrate their sturdiness in the organization? Can they rebound quickly? Can they regroup quickly? Can they move on, as you said, Luke, to the next big decision? And so I'm seeing some of that theme repeat. Greg, I understand we have another question.
Moving forward on other projects, will you continue to work down several layers into the supply chain? And will you continue to escalate supply chain issues faster?
Yeah, I'd say that's a yes, with certain conditions. Now, whether we could do that across our entire portfolio with all of our suppliers, I think that's questionable. It starts to become a real labor issue. But on our high priority projects, like a COVID vaccine, like some of our other top products, yeah, I could see our procurement focus shifting into that type of a role on a greater basis, where we not only do it, but we build it into our agreements, that we build that collaboration with the suppliers early on so that they understand that we're here to help. We're here to make this happen. There was some reluctance with some of our suppliers in doing that, but once they saw the value, it just kind of clicked. It was great results.
Terrific. Thank you for that, by the way, Owen. Another question, please, Greg.
Considering its shelf life and the requirement for refrigeration, how is it being delivered across the globe? Or are you only manufacturing in the U.S. for distribution in the U.S.?
Good question. But unfortunately, that's probably too much detail that I could provide. There's obviously the public information about our distribution plans and our strategies, the details of which, without confidentiality in place. Can't really devolve into those details. So apologies on that one.
What Luke's telling you is he has the answer, but he's not going to tell you. He has the answer and he's not going to share it.
But there's a lot of information that's already publicly available on this topic. It was a significant challenge for us on how to establish those types of supply chains. New technologies had to be developed. They were successful and have been successful. They've proven to be very resilient. So yeah, certainly look through, Wall Street Journal has published a lot of information on that. It's pretty accurate, and but we're not permitted to get into the real details of that.
So whoever asked the question, he just threw you a bone and told you where to go sniff.
Yeah.
Thanks, Owen. Another question, Greg.
Talk to us about stress for your teams to work under such tremendous pressure to hit delivery dates and still keep their family and personal lives intact while working remotely.
Good question. Yeah. What did you do to keep your team healthy and energetic?
Well, I'll speak for myself. I quit on January 1st. So I'm
Don't use that strategy, Luke. They can't afford to lose you.
It was purely coincident. It was long in planning, but this is a great topic to bring up because I was very concerned about my team going through all of this. There's no question that this has had an impact on all vacation plans, all types of schedules, personal schedules with families, a lot of 24/7 work at our sites. It's really had a cascading effect and has impacted many, many people. My concern long term would be, gee, how long can we sustain this without getting more people involved? Luke, what do you see on your side for this?
Yeah, it's a very, very good question. And obviously it's important for us in this stressful environment, but it's important for everybody, right? Working from home, working under this duress is not simple, right? So even if you're not working on a COVID vaccine, it is very important to make sure that you're still checking in with your teams, specifically because you can't walk by their desk, right? And you have to be checking in on people relative to where they're at, right? Remote working, being able to make sure that you're not just doing work together, right? There has to be time for coffee breaks, which you can do virtually. There has to be time for, asking the question, hey, did you stop for, an hour in the afternoon to help your children with their homework? You can work an hour later at night if you want to. Take that 1 to 2 p.m. break and do something different than you, right? So a lot of it is checking in very specifically one-on-one with your teams to make sure that they aren't just working at work. Sometimes the hours are weird. Pfizer is a global company. We have manufacturing happening in all time zones, right? So it would be very easy to just stay plugged in all the time. But it's the intentionality of you as a leader with your team to make sure individually you're checking every person to make sure that they're, one, healthy, they're okay, their family situation's okay, and that they're taking a break. Very, very, very important for us, but I would say it's just as important for everybody else who's on this call.
Yep.
Super. Thank you for that insight. Boy, truer words have not been spoken. That's terrific advice. Greg, I understand we have another one that's in the queue.
How did the necessary collaboration impact current communication channels? Did those methods and media change?
I don't think they changed. I think they certainly took on greater importance, right? So communications, again, we spoke a little earlier about how a separate team was really put in place to manage the COVID efforts. That streamlined the communications in itself so that communications became more crisp. They became very direct in a good way. People understood their immediate objectives and their long-term objectives through clear and crisp communications. That flowed out to the supplier community as well. So I think by really narrowing down the number of people and the focus areas on COVID helped to drive very strong communication.
Luke, any input on that?
Yeah, I think, in general, if you talk about the tactile tools and things of that nature, so Pfizer was a fairly technologically robust company even before COVID. So web conferencing, teleconferencing. So people were very familiar with that. There was some level of remote working already happening. This situation just took it up to the next level. More people were working remote. You had more engagement of the manufacturing colleagues who obviously are working with their hands with people who are more remote. So, for example, if you're doing an investigation, as opposed to everybody sitting around a conference room table doing an investigation, now you're sitting around a WebEx, right, or one of those type of functions. So, Pfizer was prepared. It just went from a standard level to a very heightened level. So the technology is in place and in use, and we just use more of it.
Super. Thank you for weighing in on that, Greg. I think we've got time for one, maybe two more. What's the next one?
Doing it in one area has impact on everything, including redirecting resources and burnout of people. Those have impact that makes it hard to sustain. How does that balance the tidal wave of changes coming?
You guys can interpret that question however it fits your answer. I'm not sure I was real clear on it, but
No,
you want to take a swing at the ball, Luke?
I was going to let Owen take a swing at this one.
Of course you are. Okay, Owen, ball's in your court.
So
Quick throw to second base.
If I caught that right, what are the lasting impacts of this and how we do things? I think Pfizer. My experience at Pfizer goes back many years, and I'd say the one thing that continues to surface within Pfizer is it's a very strong learning organization. Now, this is an interesting case with COVID where the goal was so crazy. People were shell shocked when it first came out a year ago that, we're going to do this and it's going to be done when. But once the organization took on that challenge and started moving in the right direction, new processes were developed, new techniques, new tools were used. Those are going to continue on, and I'm sure will be used on many of our other initiatives and products going forward. So we'll learn from that.
Great. I want to take a moment to thank you folks. I know you don't have time. You're making time for us, and it honors us when you do that. So I want to thank you for your time with us. You've been listening to Owen Brooks and Luke Kimmel, who were managing the swift changes in the procurement process at Pfizer in response to the COVID-19 crisis. It'll be very interesting in the fall of the year, or maybe this time next year, to do a post-COVID. Hopefully it'll be post-COVID. We're believing and hoping and praying for that, a post-COVID analysis of this approach to rapid delivery of that life-saving vaccine. And we are in war. We are going to win the war. The construction engineering business is going to help win the war. We're going to bring the big guns to the process. And we're just very, very proud of you folks for taking time to be with us and sharing with us your insight. If your question didn't get answered, we'll make sure that you have contact information for Owen and Luke, and perhaps you'd like to follow up. One of the hallmarks of CURT is our opportunity to connect and providing capability connect and actually good connection information. We guard that like the gold at Fort Knox, but we're very generous with it among the members of the Construction Users Roundtable. So if you have a question and you'd like to reach those two folks, we'll make sure it happens. So Luke and Owen, once again, any final thoughts before we go on to our next event? Any final words, Luke or Owen?
Well, I just wanted to extend my thanks for letting us take the time to walk you through what our challenge has been over the last year. Again, it's been very exciting. We're learning a lot from it, and at some point in the near future, we hope to share some of that with you, and perhaps it'll help change things up in your organizations as well. So thanks, and have a great night.
Oh, I appreciate it. Luke, anything that you want to add to what he said?
Yeah, just thanks for letting us share, be part of this great program, and just encourage everybody, stay safe, be smart, As you said, we're fighting a war here, and just ask you guys to be safe and keep your family safe as we go through these times.
Get the vaccine.
We are, and wear your mask. Mine's capably ready. I've got, I think, one in each pocket, just in case, and one on a coat pocket, etc. So mask and distance, sanitize, and get the vaccine. My wife got her first shot today. So thank you, folks, very much. We'll be in touch. Good luck to you.
Thanks.
Thank you.